Friends, we are still bombarding you with information about gynecomastia, and today I will discuss physiological gynecomastia with you. What is physiological gynecomastia? I will surprise you shortly. Physiological gynecomastia is, dear friends, essentially present in 3 periods. The changes that occur during these periods lead to the appearance of gynecomastia. The first is the newborn phase, which occurs at birth. The second is during puberty, and the third is when we reach maturity and subsequently in old age. In these 3 periods we can have gynecomastia without any problems, or we may develop gynecomastia. I mentioned that the first is the newborn stage. Let me explain it to you. While in the womb, we could be male or female, it doesn't matter. Whether we are boys or girls, we are exposed to an estrogen hormone due to our mother. And this estrogen hormone inevitably results in a minor growth of the milk glands in our breasts. Generally, in Anatolia, there are folk beliefs that when babies are born, people say, "Oh, there are lumps on the nipple, press them down." I strongly advise against this. It's due to the estrogen we get while in the womb. If the baby is born male, the estrogen levels will decrease and fade away over time, affecting that knotted appearance. Or it could be about the growth of breast tissue. It will also regress, shrink, and eventually disappear. Therefore, there is no need to suppress or harm the baby. Just waiting is enough. The second aspect occurs during puberty. During puberty, hormones are very active, friends. Because of the secretion of different hormones, especially in young adult males, growths can appear in the chest area. Here, a bit of patience is required. Sometimes patients approach us during this period. While in puberty, students ask, "Can we have surgery, teacher?" As this is a physiological gynecomastia in the puberty transition. After a certain period, it will regress again. You should not have surgery. You need to wait a bit. What is the one exception to this, friends? Our endocrinology colleagues provide us with their evaluations based on their assessments. In adult patients, they can direct those in the adolescent transition phase for surgery. Naturally, they send us referrals after they have assessed all these examinations. Thus, we recommend that patients in the adolescent transition phase wait a little longer and advise them accordingly. Once the transition to adolescence is completed and hormones stabilize, there will be no issues left 99% of the time. It's beneficial to be patient. The third period is old age. Friends, in this stage of aging, sometimes if there is too much fat in our body, estrogen production can happen in the fat tissues. And as a result, especially with aging, testosterone levels can decline. A slight drop in testosterone can disrupt the estrogen-testosterone balance, leading to some breast enlargement. This represents the third degree of physiological gynecomastia. Therefore, we see physiological gynecomastia occurring in 3 periods: in newborns, during the onset of puberty, and in the elderly. And in these cases, we often refrain from recommending surgery. We suggest a waiting period is needed. Please stay tuned.